Good morning, Canada. It is time to get moving this morning, and foot injuries are on the rise. Don't we know it with our friend Dina Pugliese over here? So what can we do to avoid them? Joining us now is Dr. Liza Egbogah with exercises to get you back in step. Good morning, Dr. Liza.
Good morning.
So good to see you, and that T-shirt. Can you talk to us about that?
Yes, so I combined with a designer in Nigeria named Woman to design a T-shirt to raise money for PPE in Nigeria. So while we've moved ahead to the vaccine stage, in Nigeria, many of the hospitals and health workers don't actually have enough basic PPE to keep them safe. So they don't have the N95 mask. And then treatment-wise, they don't have oxygen. So all proceeds from the sale of this T-shirt are going directly to purchase PPE for health workers in Nigeria. And not only will that help save their lives, because, you know, there's been so many doctors and nurses who've actually been passing away from COVID, but it'll actually help keep the patients safe as well, so that these healthcare professionals are not passing it from patient to patient.
So purchase the tee and help support those who need it with PPE. Where do we get it?
And it's very cute. So you can buy the T-shirt at drlizashoes.com. So DRLIZA shoes.com.
Okay, speaking of that, we're wearing a lot of T-shirts, not so much shoes for people working at home, but there's still an increase of foot injuries. How come?
Absolutely. So you would think that with people wearing shoes less and not going out as much, that there would actually be less foot pain.
Yeah.
But I'm finding that there's actually more foot pain and more foot injuries. And there's two main reasons why. So generally when someone has, you know, something like plantar fasciitis or metatarsalgia, which are foot problems, someone like me will prescribe orthotics or recommend that they wear supportive shoes in order to help their feet.
Yeah.
So now people are spending time at home and they're going barefoot.
Right.
So with all these problems that they don't have the support, and so they're ending up with more injury. And then number two is that we're sitting more than ever.
True.
We're sitting on our couches, we're sitting all day. We're not getting up to go for a coffee run in the middle of the day or to grab lunch. And what that does is it actually causes our hips to tighten up. When our hips tighten up, we end up rolling in more, which is something called overpronation. And that puts so much stress on our feet. So now we're overpronating more, we're straining our plantar fascia, and we're not wearing supportive shoes. So those are all a recipe for disaster.
Okay,
and
guess
then,
what?
People are
You're going to fix it. You're going to help us right now. Let's get moving this morning.
Absolutely.
Let's go, Dr. Liza.
Yeah, so I'm gonna step back. I'm gonna kick off my supportive slippers.
Kick it off.
And we are going to start with a calf stretch. So with a calf stretch, you're going to put your heel on the ground, your toes are pointing up, and then you're slowly going to bend over so that you feel a stretch at the back of your calf. And you want to hold that for 10 to 20 seconds. And then you want to make sure to do the same thing on the other side.
You feel that.
Really good. And the calf stretch is so important for our feet because if your calves are tight, that leads to foot pain. Now, another thing we want to do is we want to strengthen our calves and actually strengthen the muscles in our feet. To do that, we're going to be doing heel raises.
Okay.
So with the heel raises, we're actually getting up on our toes. You're trying to balance so that each one you're doing for 5 seconds. So you're 1, 2, 3, 4, 5, and then down. 1, 2, 3, 4, 5, and down. And you want your heels to be lifting off of the ground.
Now, if you're
Look like you're a
wobbling,
dancer, like a
if you're
ballerina.
wobbling, is that okay?
You can use a
If
chair
you're
for balance,
wobbling,
yeah?
You can use a chair for balance or something for support, but that's a good indication that those muscles are weak and that you could benefit from strengthening them, which will help decrease your chances of foot pain. And if you have foot pain, it'll help it feel better.
It's true, because Diva's doing his with ease, and I'm having a hard time. So I need to strengthen.
Absolutely, and that'll prevent foot injuries in the future as well. Okay, so the next thing that we're going to do we're going to do side leg lifts.
Okay.
This is important because it strengthens our gluteus medius muscles, which is one of our main stabilizers when we walk for our gait. So it helps with overpronation. So to do this, and again, you can use something for support. You're just bringing your leg out to the side as high as you can go, and then bringing it back down. So each is to about a count of 3. So 1, 2, 3, 1, 2, 3. And you should really feel this glute working as you bring this up. And you want to do 10 of these on each side.
Dr. Liza, do you rest your foot when it comes back, or do you keep it moving?
And the thing is, if you're advanced, you can just keep it moving and you don't need to take a break on the ground. However, if you're first starting out, you should stop and then bring it up.
And I notice your waist up does not move.
Yeah,
so if people are doing like a ding-dong thing.
I'm leaning a little bit, so you want to try and stay straight up, right?
You want to stay straight because you're using your glute medius muscle and you're also engaging your core. And the reason why we're doing this barefoot is because not only does it help strengthen our glute medius muscle, it helps strengthen the arches and the muscles in our foot that are keeping us balancing. Because balance is so important when it comes to feel-good feet.
This feels very Harry Potter. Gluteus medius.
I love working my gluteus medius. All
That's right.
Yeah, but you guys are doing awesome.
Okay, next.
So the next thing that we want to do is we want to stretch our quads. So as I mentioned before, too much time spent sitting causes our hip flexors to tighten up, and then our quads get really tight, which contributes to overpronation and foot pain. So to do this, you're just going to grab your foot and you want to try and bring it as close to your heel, as close to your glutes as possible. And the great thing about this one is not only are you stretching your quads, but you can use your fingers at the top of your foot and you can use it to just press that in, so you're actually getting a stretch at the top of your foot as well.
Now, if it's too hard, Dr. Liza, can people use a towel to assist?
Absolutely. So you can use a towel, you can use your t-shirt, roll it up, and then use that to grab you if you can't grab your foot. And then you want to also do that on both sides.
That feels, I can feel that opening up.
Right,
You, D?
Yeah, for sure.
Oh, yeah, big
And make
Good
sure
stretch.
you're feeling that at the top of your foot as well.
Right.
Oh, I see.
Now, if you're able to do this quad stretch comfortably and it feels like it's not painful, then we can go into another exercise which challenges our balance and really opens up our hip flexors. So this one is dancer's pose.
Okay.
So to do this one, you're going to have your palm facing up, and then you're going to place your ankle in your palm. You start with your knees together.
Oh.
And then you want to kick your leg out. So you're feeling an opening.
Oh
in
my
your
gosh, that hurts. In the quad.
Yeah, so
Are you wow.
so then you might, and then you want to hold this for about 30 seconds.
Can we just look at Dr. Liza's leg and where it is right now?
Can we go full screen on her?
Oh my Cirque du Soleil, what is even happening?
Well, I try to keep my hips open because I'm a severe overpronator, so if I don't keep my hips open, my feet will not be happy.
That is amazing.
There you go, and then you want to do that on both sides.
Right.
Unbelievable.
And you can even put your arm out as well.
I feel like, that balloon.
We look like twins for a second.
Walking on air. Remember that, T? Thank you, Dr. Liza. Where do we find more? Oh, yeah, we're loose. We're open now.
Yeah, it's good.
Where do we
You
find
can
more?
find more at dr-liza.com, and for the t-shirts again, that's drlizashoes.com.
Awesome.
Perfect.
Thank you so much. And help
Thank you,
support
guys.
the t-shirt. It's such a great
Yes,
cause.
Thanks,
please.
Dr. Liza. Good to see you again.
Thanks, hon.
All right.